So you go like that, it bends backwards, and it'll tear the ligament off the bone there. So those are probably the top 3 ways we see the ACL tear.
Number 6, we got blocked out a couple times. That was enough to tear hers up.
Yeah. You know, something why girls have it more than guys. You know, it's kind of an interesting thing that people like him and the science guys are looking at. The girls land differently than guys. You know, if you watch girls land, guys when they jump, they'll land with their knees flexed and their hips flexed, whereas girls will land more straight up. And I mean, I'll see that. I'll be at a girls' game, and I'm like, man, that's exactly what's happening. You know,
ready for new business.
Yeah, they kind of land, and then if your knees are straight and you off balance a little bit, you can hyperextend or turn sideways. You can have the trunk control. That's one of many theories of why girls tear so many more than guys do.
The technology has improved. The MRIs have allowed us to properly diagnose that somebody does have an ACL tear. I think also we've gotten smarter in our rehabilitation. When somebody was injured in the past, they would have the surgery, they would be basically put in a cast, and then you're trying to get range of motion back after the surgery. Now, immediately after the surgery, they're moving. We're working on doing the rehabilitation. Also, I think the most important aspect is we've gotten smart about doing what I call prehab, where we actually get the knee ready for the surgery. So most times they don't even go into surgery until they've got all the swelling out, all the range of motion back. When you get all the range of motion back before the surgery, it makes getting range of motion after the surgery that much easier. So now we're not fighting swelling or a lack of range of motion after the surgery. We go in with a pretty good looking knee, minus the ACL. They go in, they reconstruct it. Like Dr. Hagen was saying, what they end up doing is now with the arthroscopic, you have a lot less trauma to the knee. And then what we do in a therapy aspect is the first thing we're working on is trying to get that swelling down. Then the second thing we're working on is trying to get full range of motion. And then after that, once they've got no swelling, full range of motion, what we're working on is trying to get their knee symmetrical. So with that, we're trying to make sure that we have full strength, equal strength bilaterally, because you don't want one knee or one leg that's going to be stronger than the other one, which might cause some problems down the road. That entire process, usually for an ACL, takes about 6 to 9 months for most people. And then the last part of what we're working on is kind of that functional progression, because what we find a lot of times is physically the person's back, mentally is the hard part. It's a lot of times the ACL is a non-contact injury, so it's getting confidence back in that knee, and that's what the therapy does. Is we progressively increase the stresses to the knee once they have full range of motion and strength, so that when they get back into competition, they're not thinking about the knee anymore, and they're just working on thinking about playing the game. So.
Which is tougher from your standpoint, the mental or the physical?
I think the mental is definitely the hardest, because you know that the knee is ready to go, but it takes a while for that person to get the confidence in it. And a lot of times it takes that first hit, it takes that first fall, it takes that first landing on the knee again and realize that they're okay, that finally they get over the hump. Because you can do a lot of stuff in the functional progression where obviously there's not people falling at your feet in football and all that. That's always the hard part. Once that gets over and they get that, then things start to get moving a lot quicker after that. Some people get over the mental aspect sooner than others too. So,
the success stories that you've seen, personally, I don't know if there's a local student, maybe athlete who tore something and was able to come back.
I mean, the one that I remember is Torrey Williams when he basically dislocated his knee in the Indiana State game at the beginning of the year. I mean, that was a pretty devastating injury that actually took about 3 surgeries before it was all said and done, before we were actually able to really start the rehabilitation process. So, in the older, not in the old days, but in years past, it would have been much harder because the technology has improved so much that we're able to, and a lot of it is the motivation and the dedication of the athlete. I mean, it's a long, tough process to come back from an ACL. And the more motivated the person is, the easier it is on us, because a lot of times we're just helping them, guiding them along the way. It's up to the person that's willing to do what it takes, not just in the clinic or in the training room when you're working with them, but at home doing the little extra stuff. So.
can this be prevented? What can I do to not have this happen to me? Can I stretch a whole bunch without help, that sort of thing? Are there preventative measures you can take to ensure that you don't, and Dr. Hagen talked about, jumping and things like that, coming down with your knees a little bit, your hips as well. But anything we can do as far as stretching, things like that, to prevent this from happening to us?
There are programs out there, and what they do is, when you talk about stretching, it's mainly what I was mentioning earlier, is trying to get the lower body, especially the legs and the muscles, symmetrical. So you look for muscle imbalances. Do you have, quadriceps or hamstrings that are weak on one side compared to the other? Do you have tightness in your hip musculature? And then a lot of it is balance. You work on landing biomechanics and kind of increasing what we call proprioception, or basically your mind's ability to know where your foot is without having to look at it. So if you know where your foot is, it's going to help you land. And just how Dr. Hagen was talking about landing biomechanics, making sure that you're not landing straight-legged. Make sure you're bending your knees when you're in absorbing the force instead of landing straight-legged. And then when you get knocked off balance, that causes that rotation motion, which then can kind of shear off the ACL and cause that tear.
What have I missed?
I guess the big thing is the 5-star rating. I think what most people don't realize and sometimes maybe even overlook is in Lafayette, we have here at St. Elizabeth's a nationally ranked 5-star orthopedic center here. So, you don't necessarily have to go down to Indianapolis or up to Chicago or New York City to have quality care here in the city of Lafayette.
Terrific. I dated a Purdue volleyball player who did something, was able to stay here and get it done, rehab at home, and have it all done the same day.
Well, and I think the one thing though is, people hear about all these ACL tears, and honestly, the number is not any more than that is typically happening.
Oh, right.
The problem is that it's the big names. It's the
Hummels,
Rob Marvs, it's the Ralph Boldens, it's the Robbie Hummels, it's the Keith Smiths. Nobody knows about the third string, backup linebacker that has a ACL tear, or the long. Yeah, people don't hear about those. They only hear about the big marquee names. I think if you look at the total injury rate over time, it's very cyclical. I mean, sometimes you have a lot, sometimes you don't. So in that aspect, I don't think the injury rate is any higher. It's bigger names this time.